Diabetes and hyperglycemia are often interconnected, yet they describe distinct medical conditions that affect how your body processes blood sugar. Diabetes is a chronic condition where the body either doesn't produce enough insulin or doesn't use it effectively, leading to elevated blood sugar levels over time, whereas hyperglycemia is a state of high blood sugar that may occur in people with or without diabetes. Symptoms of diabetes include increased thirst and urination, unexplained weight loss, and fatigue, while hyperglycemia can cause headaches, blurred vision, and difficulty concentrating. Treatment for diabetes often involves a combination of lifestyle changes, blood sugar monitoring, and medication or insulin therapy, but managing hyperglycemia might simply require adjusting your current diabetes management plan or seeking immediate medical attention for those without diabetes. The risk factors for developing diabetes include obesity, physical inactivity, and genetic predisposition, while anyone with diabetes can experience hyperglycemia due to factors like diet, illness, or medication. Here's a deeper dive into the detailed aspects of diabetes versus hyperglycemia. Primary cause: metabolic disorder versus symptom indicator. Diabetes and hyperglycemia are intertwined yet distinct clinical entities, which often leads to a conflation of the two. Diabetes is a chronic metabolic disorder characterized by the body's inability to produce or properly use insulin, leading to elevated blood glucose over a long term. There are multiple forms, including type 1, type 2, and gestational diabetes, each with different etiologies. Hyperglycemia, on the other hand, is a symptom indicative of high blood sugar levels, which can occur in diabetes but can also be a result of acute stress, certain medications, or other underlying conditions. Whereas diabetes requires comprehensive management involving diet, exercise, medication, and monitoring, hyperglycemia may be a transient issue, rectifiable by addressing its primary cause. The distinction is crucial for appropriate management, as chronic hyperglycemia due to diabetes increases the risk of serious complications, including cardiovascular disease, kidney failure, and neuropathy. Onset nature, chronic condition versus acute, transient episode. Diabetes and hyperglycemia are intricately linked, yet they present distinct clinical pictures. Diabetes, a chronic condition, stems from the body's inability to produce or use insulin effectively, leading to consistently high blood glucose levels. Its onset is gradual and requires long-term management, including medication, lifestyle changes, and monitoring. Conversely, hyperglycemia is an acute or transient episode where blood sugar spikes can occur in diabetics and non-diabetics alike, often triggered by factors such as dietary choices, stress, illness, or medication. While hyperglycemia might be a symptom of existing diabetes, it can also be a standalone event, necessitating immediate but not necessarily chronic medical intervention to prevent complications like diabetic ketoacidosis in individuals with diabetes. Underlying etiologies: autoimmune, genetic versus various triggers. Diabetes encompasses a group of metabolic diseases characterized by chronic hyperglycemia owing to insulin resistance or deficiency, with type 1 diabetes involving an autoimmune destruction of pancreatic beta cells, and type 2 often linked to genetic predispositions and lifestyle factors. Hyperglycemia, on the other hand, is a symptom rather than a disease itself, representing elevated blood glucose levels that can result from various triggers, including stress, illness, or dietary choices. Distinguishing between the two requires assessing the persistence and etiology of the blood sugar elevation. Diabetes is a continual condition with specific biomarkers like autoantibodies in type 1, while hyperglycemia might be transient or situational, hinting at a range of other potential conditions or triggers. The differential diagnosis hinges on identifying whether hyperglycemia is an episodic occurrence or part of a systemic disorder such as diabetes, necessitating comprehensive evaluation for accurate management. Treatment approach: long-term management versus immediate correction. When comparing diabetes and hyperglycemia in the context of treatment approach, the distinction lies in the time frame and strategy of medical intervention. Diabetes, a chronic condition, requires ongoing management focused on maintaining balanced blood sugar levels over time. This involves a combination of lifestyle modifications, regular monitoring, medication, and possibly insulin therapy to prevent complications. On the other hand, hyperglycemia, which is a symptom of high blood glucose levels, may necessitate immediate attention to reduce the risk of acute complications like diabetic ketoacidosis. Treatment typically includes rapid-acting insulin and hydration to swiftly correct the dangerous glucose spike, emphasizing the urgency of acute care over long-term management. Complication spectrum: systemic organ impact versus secondary to underlying cause. Diabetes and hyperglycemia are intricately linked yet distinct. Hyperglycemia, characterized by elevated glucose levels in the bloodstream, often manifests as a symptom rather than a condition in itself, flagging potential diabetes. However, persistent hyperglycemia is a hallmark of diabetes, a chronic metabolic disorder that impedes insulin production or function. The systemic organ impact of diabetes is profound, affecting the heart, kidneys, nerves, and eyes, and it can lead to secondary conditions such as neuropathy, retinopathy, and nephropathy. Contrarily, isolated hyperglycemia might result from acute stressors like infections or certain medications, representing a secondary condition tied to an underlying cause, which, when resolved, also alleviates the hyperglycemic state. Thus, diabetes emerges as a foundational disease with widespread complications, whereas hyperglycemia can be both a symptom and a transient medical issue.